One of the most common procedures that I do here is upper eyelid surgery, or medically known as upper blepharoplasty. I'd say I get approached about this question very frequently because sort of the eyes are one of the earliest places where you see signs of facial aging. And so a lot of times patients who are requesting facial rejuvenation will first focus on the eyes because that's really where they first see some of the changes. Specifically, what oftentimes patients notice is that they have a little bit of sagging, like extra skin sort of in this upper eyelid area. And it gives them, they feel a little bit of a tired appearance. And so oftentimes patients will come saying, I feel my eyes look tired, but I don't feel tired. I'd just like to look a little bit more refreshed and kind of like to look more how I feel. So this is very commonly what I hear from these patients. In these patients, actually, oftentimes if I take a look, you'll see a little bit extra skin here. Patients who've waited on this for a while, who have, for example, more severe sagging, you'll actually see the excess skin being so much that will actually even sit down on the eyelashes. It can actually even impair their visual field and actually make it more difficult to open their eyes. So there's really a variety of degrees to which you'll sort of see this. But in terms of rejuvenation, typically I just see patients who have just a little bit of excess and they would just like to get a little bit of improvement in that area. In terms of best candidates for the procedure, since the procedure really involves just removing a little bit of excess skin and really trying to reshape that eyelid fold a little bit such that it looks a little bit more rejuvenated, best candidates are really patients who specifically have that exact problem. Where oftentimes patients, when they come in to see me, they've already said, I look in the mirror, I feel if I could just tuck this in here, or if I just kind of pull this specific area of skin, if I could just remove it, that would be great. Those are great candidates for the procedure because it's very straightforward. There's a very specific anatomical surgical goal in terms of what we want to do, and so patients get very nice results if that's the case. There's actually a subset of patients who are good candidates for upper blepharoplasty who actually also have a separate issue, which is that their eyelids can actually droop. Oftentimes this is confused with, well, I have extra skin here and it looks like it's drooping, but in some of these patients with this condition called eyelid-ptosis, the issue is that in fact their eyelid margin actually sits a little bit down over their pupils, kind of like this. For those of you who may know like the cartoon Garfield, a lot of times I'll tell my patients these are patients who have like Garfield eyes. The way Garfield's eyes are kind of drawn with the lid a little bit down over the pupils, that's patients who have eyelid-ptosis. That is a separate issue that can be addressed at the same time as upper blepharoplasty, but it is a separate issue, and so it's important during the examination for me, for example, to really assess and see the eyes and really see if the patient has excess skin and if they have, in addition, eyelid-ptosis, because those are two separate issues that have to be addressed surgically. In terms of procedure itself is very straightforward. It's usually about an hour and a half long. There's a little bit of extra time required if there's a ptosis repair that needs to be done as well. But it's under local anesthesia and very well tolerated. Patients essentially are draped surgically, prepared surgically, but they're awake during the procedure with local anesthesia. They're very comfortable. It really takes, like I said, about an hour and a half or so. In terms of post-procedure recovery, what I tell patients is that afterward you can expect a little bit of bruising and swelling to persist. Probably most of it goes away by about 2 weeks or so, but if there's any residual, it does continue to improve over the first 6 weeks to 6 months. But really in terms of being comfortable going out and about, I'd say most of my patients are comfortable going out at about 2 weeks. I do have a number of patients who are comfortable at about 1 week going out, but I always tell patients just give yourself 2 weeks, make sure you have enough time to recover, so in case you do need the extra time, you won't feel rushed, feeling anxious, waiting for things to recover more quickly. In terms of what to do after the procedure, I tell patients afterward I'd like you to kind of keep your head of bed elevated for a while, usually especially for the first 48 hours. I do have them sort of ice the areas where we do the operation, 20 minutes with ice on, then 20 minutes off. Have that do that kind of for the first 12 hours, and if they can, for the first 2 days. Overall, procedure is very well tolerated. I'd say that, again, it's probably one of the 2 most common procedures that I do here in my clinic, and we get very nice results. Patients are very happy with it. It gives them a nice rejuvenated appearance, and it's a very, very straightforward and simple procedure.